Hi, everyone. My name is Dr. Angie Curtis. I'm a pediatric sports medicine physician here with UT.
Hi, I'm Christina. I am a sports dietitian with the Ironman Sports Medicine Institute.
All right, and we're here to talk to you about heat illness and nutrition and hydration. And so the two go together because definitely being properly hydrated prior to getting started as these seasons start back up in the fall can definitely influence how well our athletes perform when they get back on the field. I'll talk about the different types of heat illness and some risk factors for them, what to look for, how to manage them, and most importantly, how to prevent or treat them. So the younger population is higher at risk for getting somewhere on the spectrum of heat illness or heat exhaustion because their bodies are just less experienced with the demands of the activities that we're asking them to do. Sometimes there's a pressure for them to keep going, even when they may need to take a rest. They may feel like they're not able to kind of communicate when they might not be feeling so well, or they might need to take a break. And they also acclimatize more slowly to the environment. And the main thing that's a concern, or what puts them at higher risk, is that they do sweat at a lower rate, which is going to affect how well they dissipate heat. When we talk about heat illnesses, there's a spectrum of mild, moderate, and severe. One is at risk for heat illness when the heat that they're generating is occurring at a faster rate than they're able to lose or dissipate that heat. And so there's intrinsic and extrinsic risk factors for heat illness. Some of the extrinsic factors are not taking enough breaks, not having access to water, if they're wearing heavy equipment or clothing that's not breathable material, that can also, those things can cause them to not dissipate heat as well. And some of the intrinsic factors could be medications that they're taking, the level of hydration they had prior to getting out there, if they're recovering from an illness, or even their body mass index. The overweight or obese kids are at a higher risk as well, or their level of conditioning, especially with the year that we've had. A lot of kids have not been exercising at the rate that they're used to, but of course we'll want to go back out there full force.
I know I've seen with football players especially, so you talked about equipment being a big deal. So when our young high school football guys get out there, conditioning's maybe not the best over the summer. They're wearing padding and helmets. And a lot of these guys are bigger guys. And so I've seen sweat losses of like 6 to 8 to 10 pounds in a couple hours. And so it can really, I think that clothing and everything can really impact how much they're sweating, and can really impact that kind of heat and body temperature management as well.
And so what we do know about how we dissipate heat is that you produce 20 times more energy at maximum exertion than you do at rest. And our body does a good job of regulating temperature, but the way that our bodies function, it's optimized within a certain range of temperatures. And when you start to deviate outside of that, that can cause some problems. The perception of exertion does increase with heat and humidity. And so it doesn't always take a high temperature for heat illness or heat exhaustion to occur. And the higher the level of humidity is in the air can affect our cooling ability. Go ahead.
No, I was going to say, I joke, a lot of our soccer players come in and they say that Houston heat is unlike anything else. They train and compete in the summer. And I tell them I've lived in Houston my whole life, and it still like punches me in the face every time, because it is that humidity, and we can't quite get that cooling factor the same as maybe in a drier climate.
Same here, born and raised in Houston, and still have not adjusted to this weather.
Yes.
And so one of the ways that our bodies try to regulate our temperature is by dilating the blood vessels, shunting more blood to the skin away from the organs, just trying to, have an exit strategy to get rid of this increasing temperature. So starting off with the mildest form of heat illness would be heat cramps. And these are involuntary muscle contractions They can happen in the calves, they can happen in the abdominal muscles, the quads, Charlie horses that seem to come out of nowhere. And it's usually due to an electrolyte imbalance or deficit. Again, going back to having proper nutrition and hydrating before you get out there. This is one where the core temperature isn't usually affected.
Right. Yeah. So I think in this case, fluid and electrolyte does help. The other thing that we've kind of seen too is actually carbohydrate intake too can be helpful in preventing some of these kind of mild heat cramps. So carbohydrates are our muscle's best energy source. And so making sure that we'll talk a little bit about sports drinks at the end, but I think that would be a great option if it's in a hot environment where you're training at a high intensity for over an hour. Having something that's got fluids, electrolytes, and those carbohydrates can be really helpful in preventing some of those cramps.
When it comes to the cramps, they're usually not severe. They don't last for a prolonged amount of time, enough to where the athlete should stop what they're doing and come out. But they usually resolve fairly quickly. And some treatment options are stretching, icing, of course, having a solution on hand to replace the electrolytes that have been lost. And this is, again, on the milder end of the spectrum. So usually they can just return back to activity once the symptoms have resolved.
So you mentioned on your slide pickle juice, and I think that's an interesting one. And so, yes, there's the sodium in pickle juice. There's actually this idea that things that are kind of like pungent tasting. So pickle juice is one of them. There's also a product on the market called Hot Shot. And so the theory behind those is that when that really kind of spicy or, intense flavor actually hits the nerve receptors in the back of your throat, it may shock your system a little bit to release that cramp. And so that's why, we pickle juice is something that athletic trainers, I think, have been putting on the sidelines for forever. And it works. I think the sodium's important, but the more immediate effects is probably from that kind of like really strong tasting flavor that's resetting our nervous system a little bit. The other thing I've seen being used is actually mustard. Oh, wow. And so again, so that really kind of intense flavor may help a little bit. Again, that's going to be a really temporary fix. We still need carbs and fluids and electrolytes and all those things, but that may help a little bit just to release that heat cramp kind of in the moment of competition or something like that.
Okay, it's good to know. And so next we'll move on to heat exhaustion. And this is where now the body is not really meeting the demand of dissipating heat appropriately for the level of the temperature that's rising. And this can happen in, again, hot, humid, or normal conditions. It may or may not be preceded by the heat cramps. It doesn't always start there. Sometimes this is the presenting sign or symptom of a heat illness. This is one that the neurologic exam should still be normal. They should be awake, alert, aware of what's going on, but they may, have some nausea. They may be dizzy. And this can progress to heat stroke if it's not treated. They need to be removed from activity or practice, go to a shaded area or go inside and be able to cool off quickly. Usually that requires putting their legs above their head, giving them some fluids by mouth. At this one, same day return is not advised because their body needs a chance to reset. And so then the most severe one on the spectrum is, of course, heat stroke. And this is where the core temperature, best measured by a rectal temperature, has now increased over 104 degrees. And this is one that can cause altered mental status. The athlete might be staggering or not answering. Sometimes they look like they might be staring off into space. And there has been a breakdown in the regulation system. And this is a medical emergency. They do need to be taken to the hospital for medical attention. They may or may not be sweating at this point. Usually there's some rapid breathing, or they may have headache or rapid heart rate as well. It's basically a system overload. So again, you want to remove them, put them in the shade, immerse in a tub if available. If not, another option is the tarp and just pouring water. If there's ice packs available, you want to cool the core off as quickly as possible. So ice packs in the groin, under the arms, by the neck if a tub is not available. And This is one where they're not going to be cleared to go back to activity without physician clearance, normal labs, and even when they are cleared to go back, they're not to go back to activity right away. Start in a cool environment and progress. So some prevention strategies for any of this are slowly acclimatizing to temperature when getting outside. It happens over 10 to 14 days. And again, make sure they're wearing light clothing to begin with, adding in the padding a couple of days later, or the heavier equipment on maybe days 3 to 5 of activity instead of right away. Pre-hydration and hydration are important, having frequent water breaks, access to water, and knowing the signs to look for. One other suggestion is having a buddy system. Of course, as a coach, it's hard to keep an eye on all athletes at one time. But if, one player is accountable for a buddy on the team and can kind of be aware of checking in, making sure they're okay. If each person is responsible for a teammate, it may increase the likelihood that something like this is caught earlier.
Great. So yeah, along those lines of prevention, obviously nutrition and hydration are going to play a big role in preventing any kind of stage of this heat illness. So I get asked a lot, like how much water do I need to drink in a day? What are the recommendations? And the truth is, for kind of your average adult, the hydration recommendations are very individualized. But I think for athletes, especially athletes that are going to be training outside here in the heat in the summer and fall, we can kind of give some general guidelines. So what I like to say is start with about half of your body weight in ounces. And so body weight in pounds divided by 2, that's about how many ounces you should be consuming, just kind of on average. And then I like to tell them, monitoring your urine color is probably the easiest way to determine hydration status. And so I tell a lot of my high school and college athletes, check first thing in the morning. That first time you go to the bathroom in the morning, that's probably your best indicator of your hydration status. And we really want to be like a pale yellow, maybe clear. So I also tell them, like, you can't be clear all the time. You'd be going to the bathroom every 15 minutes. And so, aiming for that pale yellow color, maybe prior to competition that's going to be outside, maybe then we can be overhydrated. We can shoot for more of that clear color. But in general, half your body weight in ounces is a good place to start. If you get there and your urine is still not clear, then we probably need to increase our overall fluid intake. The other way you can think about it is, especially if you're an outdoor athlete, weighing in and out of training sessions or competition. So we mentioned those football players that can lose up to 10 or more pounds in a training session. That's really fluid, right? So that's not a true weight loss. That's totally just your body water being lost through sweat. And so what I tell my athletes to do, if they can get a dry weight, so, minimal clothing, they're totally dry, they can step on the scale before training, record that weight. And then after training, kind of before they do really anything else, dry off, put on some dry clothes and step back on the scale. And so chances are they've lost some weight. And so they can take that weight loss in pounds, 3 or 4 pounds, whatever it may be. And then I want them to take that 3 or 4 pounds times about 20 to 24 ounces. And that's how much fluid they should be kind of trying to consume to replace what was lost during training. So this will be especially important for athletes that have multiple training sessions in a day. So if they're going to practice in the morning and the evening, we really want to make sure that we're replacing all of those fluids lost during that first session before they get into the second session, so they're not in a dehydrated state when they come in for the second session. The other thing that can help with hydration are those electrolytes, right? So the primary one we're losing in sweat is sodium. And so that's really the one that we want to look to replace. It's kind of become a fad recently, and some of these sports drinks have a lot of potassium, which we're not really losing that much potassium in our sweat. We are losing a lot of sodium. So look for sports drinks that have good sodium content in them. And what that's going to do, that's going to help the body hold on to that water. So sometimes if we just drink plain water and that's all we're drinking, because we don't have those electrolytes kind of drawing that water into our cells, we may not be able to hold on to as much. And so adding in some of those electrolytes can be helpful. We mentioned sports drinks as well previously. So sports drinks being things that also have carbohydrates in the form of sugar. And so I am pro sports drink in the right setting, right? So things like Gatorade and Powerade that have the actual sugar in them are not made for sitting on the couch watching TV, right? They are for those times when we are training training intensely in a hot environment for over an hour, right? So if we can kind of hit those three things, then I think a sports drink is important and or appropriate in those conditions. And so again, a sports drink is going to have fluid, which we need to replace, electrolytes, kind of help replace some of those electrolytes that we've lost in sweat, but also help maintain our fluid balance, and then carbohydrates as well, which are our best fuel for our muscle. And so, you know, and I think about like football or soccer matches that can last for over an hour, a sports drink is going to be appropriate in that setting because it's giving those things that our athlete needs overall. In addition to, you know, fluids, there are some foods that are hydrating as well. So we get most of our body's water from the fluids that we drink, water especially, but we can get it from other places. So, you know, juices and, you know, in infrequent amounts can be a hydrator. Also, milk is actually pretty hydrating. So because milk has some of those electrolytes and proteins and carbohydrates in it, it helps our body retain that fluid a little better. We talked about sports drinks, but also things like fruits and vegetables, right? Those really water dense foods are going to contribute to hydration overall. So yes, we want to be drinking a lot of water and focusing on that, but we can also incorporate some other foods that contribute to our total body water content. Last thing that I think would be helpful for you guys as you're kind of transitioning into these fall sports that are outside, especially. So Dr. Curtis mentioned like heat stroke and heat exhaustion, and we definitely want to try to prevent those things as much as possible. So hydration can help. Like she mentioned, the way your body cools off is by drawing that blood flow to the surface of our skin, and we sweat. So we release some of that water, and that releases the heat, right? And so we want to keep up with our hydration because we want to be able to keep sweating and keep releasing that heat. She mentioned, you know, sometimes we stop sweating. That's a really big red flag, and that's a sign that something's going wrong if we stop sweating in the middle of the summer. The other thing we can do to kind of help prevent some of that heat exhaustion before we even get started is using some cooling techniques. And so this is something that I've used with some of my football and soccer players. And the idea is that if we can drop the core body temp slightly before we even get started in the hot environment, then that just gives us a little bit more time before we reach those kind of peak temperatures. So you can do things, I've done things like Gatorade or even icy water, slushy kind of things. So that really cold temperature, I've just blended up some ice and a little bit of sports drink powder and water and served those in cups. And so they're drinking those while they're getting taped or before they go out, you know, they're in the training room. And again, that cool fluid is helping to drop their core body temp a little bit. The other thing you can think about is things like ice towels or ice vests, even cold water submersion. So if you have a cold tub, as maybe counterintuitive as it sounds, you can actually dunk into that tub or put on that cold towel or ice vest. And again, with the idea of dropping that core body temperature and giving your body a little bit more time before we hit that kind of a peak core body temperature. And these tactics can also be used at half times. So we do this with soccer, we do this with some of our football teams, we have those ice towels. So if there's a timeout or there's a break in the play, then we're gonna throw those on their neck, maybe under their arms, kind of in those areas that Dr. Curtis mentioned earlier, to again just bring that core body temperature down and allow them to continue to perform at a high level without any kind of negative impacts. And so those things I think are the most practical for you guys, and things that I think high school and even collegiate athletes can utilize and can put into practice so that they can continue to perform at the highest level, even when it's 1,000 degrees outside and 100% humidity. So
yes, so we hope that we've given you all some good tips and some advice before these seasons resume, and we're here to answer any questions you may have, and best wishes in all your seasons.
Thanks.
Bye-bye.